5 NCLEX questions of the day. Question number 1. Which client is at risk of getting gout? A. A client who smokes 1 pack of cigarettes a day. B. A client who drinks 3 glasses of wine at night. C. A client who is a vegetarian. D. A client who is allergic to seafood. As we recall from my last video, risk factors for gout include a high-puring diet such as meat, seafood, and alcohol. Other risk factors include obesity, dehydration, and genetic disposition. So answer B is correct. Question number 2. Which statement made by a client with newly diagnosed gout is correct? Select all that apply. A. I should drink 2 to 3 liters of fluid a day. That is correct. Like mentioned earlier, dehydration is a risk factor for gout because it decreases excretion of uric acid, which leads to gout. B. I should limit fluid intake to less than 1 liter a day. That is incorrect. Fluid intake of 2 to 3 liters a day is recommended for gout, unless contraindicated. C. I should increase consumption of vitamin K-rich foods. That is a distractor. Gout has nothing to do with vitamin K. D. I should avoid eating meat, but organ meats are okay. No, meats especially, organ meats such as liver contain high puring and should be avoided. E. I should avoid eating crabs and shrimps. That is also correct. So answer choices A and E are correct. Question number 3. A nurse takes care of a client with acute gout attack. Which statement made by the nurse is correct? The keywords here are correct statement about acute gout attack. As we know, interventions for acute gout attack include taking colchicine and NSAIDs to reduce inflammation and pain, increase fluid intake, and avoid high-puring foods. Let's go over the answer choices. A. Continue taking allopurinol as it takes weeks to start working. B. Colchicine will help to relieve pain caused by acute gout attack. C. It's okay to take both colchicine and allopurinol. D. Start a high-protein diet to help your body fight the infection. Based on what we talked about, we can eliminate choice D because a high-protein diet would include meat which contains high puring. Choice B and C both mentioned colchicine. We know that colchicine reduces swelling and inflammation, but it does not directly reduce pain, and usually NSAIDs such as ibuprofen are needed to help with pain relief. So choice B is incorrect. What about choice C? Can you take colchicine and allopurinol together? Yes, you can. They work differently and can be taken together. Colchicine reduces the inflammation from the gout attack, while allopurinol prevents formation of uric acid to prevent further attacks, which makes choice A incorrect because allopurinol does not help with acute gout attack. Question number 4. A nurse takes care of a client on allopurinol. Which finding by the nurse is expected? When a question is asking for expected findings of a medication, look for findings that can indicate the effectiveness of the medication, or common side effects of the medication that are expected and do not require additional interventions. As we mentioned, allopurinol prevents uric acid formation and is used to prevent gout attack. Side effects of allopurinol include nausea and diarrhea, which are expected and do not cause concern unless they become unmanageable. Kidney stones and liver toxicity are also side effects of allopurinol and should be closely monitored and reported to providers. The most concerning finding that is a priority and requires immediate reporting is Stevens-Johnson syndrome, which is a skin reaction to allopurinol with rashes and painful blisters and can lead to sepsis. Okay, let's now go over the answer choices. A. The client's uric acid level is 4 mg per deciliter. B. The client urinates 30 ml every hour. C. The client takes allopurinol as needed to prevent gout attacks. D. The client takes stool softeners to prevent constipation from gout. Based on what we know, we can eliminate choice C and D because allopurinol should be taken daily as scheduled, and constipation is not a side effect of allopurinol. Choice B says urine output of 30 ml per hour, which is the minimum urine output for adequate kidney perfusion. So it is not the best finding, especially on gout patients who should be drinking 2 to 3 liters a day. So choice B should be eliminated. Elevated uric acid level is considered to be more than 6.8. So the correct answer is A. By using the method of elimination, you can make an educated guess, even if you don't remember the normal uric acid level. Question number 5. A nurse takes care of a client on allopurinol. Which finding by the nurse requires immediate intervention? This question is asking for a priority finding for allopurinol. A. The client reports severe diarrhea. B. The client's liver enzymes are elevated. C. The client reports pain with urination. D. The client reports a new rash with blisters on the arms. The correct answer is D because it could indicate Stevens-Johnson syndrome, which is the highest priority because it is mostly deadly. And the next priority should be elevated liver enzymes, which could indicate liver toxicity. Thank you for reviewing the questions with me. Like, comment, and subscribe if you want to see more question reviews. See you next time.